Today, we're going to talk a little bit about women's health and how pain management really not used a whole lot in procedures for women. And the one in particular that I want to talk about is having an IUD placed and an endometrial biopsy, and what I've experienced with those types of procedures, and what I personally think that they should do to help women be able to have more comfortable, painless procedures. If you are unaware of how you do an endometrial biopsy, you should really look that up, because it is not just a walk in the park for me. And I've had 36 of them, I think, at this point, and I've had about 6 IUDs, all resulting from cancer. And I had done really well managing my pain with having these procedures done until I had a doctor that was in Texas, and she basically, like, it was horrific for me, horrifically painful. And obviously, it could have been because she wasn't trained properly on how to do these things, or just because every other doctor I had seen had done the things that I had asked prior. Let's talk a little bit about those types of things that are happening. For what I understand is, women that have never actually birthed children and they're going to get an IUD placed, they have to dilate your cervix, and the cervix has to dilate. And the way that they do an endometrial biopsy is they take this giant spatula looking like thing, tubey, and then they go up into your uterus and they pull out tissue. For me, it is not very comfortable. There's a whole lot of cramping. It's been always been super painful, and I've never had them done under anesthesia. I've done them completely awake and completely in the office of the doctor that was doing them. So, I personally think that women should have an option to be able to go under anesthesia, or have other pain management options, having these procedures done in office, because the pain is we should not have to suffer through it. We just shouldn't be told to basically suck it up, because that's bullshit. It's painful. It hurts. You literally are inserting a foreign object into an open cavity in a woman's body and ripping out tissue, and that's not supposed to hurt. Well, it does. Also, when you have an IUD placed, I want to tell you a little bit about that. I have had, I think, 5 or 6 at this point, and so far I've done fairly well with them, up until the one that I had placed, tried to have placed in Texas. And I have no idea what this lady done to me, but she traumatized me, literally traumatized me, because they had to clamp the woman, mine in particularly, they had to clamp my cervix. And they didn't tell me how badly that actually hurt if you've never had any numbing medicine on it, which apparently I had had every other time I had an IUD. When she done that, I thought I was probably going to die and pass out. That wasn't very fun. It was very awful. I do not recommend it. So, the reason that I'm even making this video is, like, if you have to have any type of anything done to your body that's related to, your reproductive system as a woman, please ask for any type of pain medication, any type of things to make it easier for you, because we deserve not to be in pain when we have to go through these things, just because we're a female. And it's just for anybody. It's not just even women. If you have to have something done and they don't offer you a pain solution, and or you think it's going to be painful, then, like, we should be advocating for ourselves, because I will not, under any circumstances, ever again have any other procedures done to my body unless I have an option for pain management, because I do not do well without pain management. If you're one of these beautiful women out there and you have to get an IUD, or you want to get an IUD, or you have to have an endometrial biopsy, or you just have to have anything done that's related to women's health, please ask for pain management. If you have a good doctor that actually gives a shit about you, they will do whatever they can to make sure that you are comfortable, because they care about their patients.